Thank you. Thank you very much. Thanks, CEO Goettl, and thanks to all of you for your warm welcome. It's a tremendous honor to be here with all of you today and serve as the Chief Nursing Officer for the American Nurses Association, an organization that's been in existence for nearly 130 years, and today represents more than 5 million registered nurses. As I stepped into this role, I think about where my journey began. It's hard to believe that 20 years ago, I was a brand new associate degree nurse working the night shift at a 25-bed critical access hospital in rural Wisconsin. It was the kind of place where patients were also your neighbors, your teachers, and sometimes even your own family. It was there that I learned one of the most significant lessons of my career. The strength of nurses is truly rooted in connection. Connection to the people we care for, connection to the communities we serve, and most importantly, the connection we have with one another as nurses. So when I think about the power of nurses, I think about that connection. I think about our shared purpose. I think about what happens when we lead with strength and speak with a unified voice. I think of this assembly and the millions of nurses that we represent. That responsibility is not lost on me, and I look forward to getting to know you better and understanding our opportunities and pain points, and working together towards solutions that put us on a path that ensures reach, relevance, and impact for years to come. So now let's pivot to the business of the day. The CNO is tasked with providing an update on last year's dialogue forums. As you might recall, these dialogue forums addressed 3 areas approved by the Professional Policy Committee and were validated by the membership assembly representatives. The first of 3 was breaking barriers into nurse workforce well-being. We know that nurses struggle with mental and emotional well-being due to inherent obligations and stressors of our profession. Tragically, the stigma and fear around seeking support still prevents some nurses from getting the help they need. Over the past year, ANA has taken a variety of actions based on this Assembly's recommendations. We've advocated for the Dr. Lorna Breen Healthcare Provider Protection Reauthorization Act. We've pressed state licensure boards to comply with the American Disabilities Act. We've written letters to Congress, CMS, and other federal agencies advocating for the same. And we continue to elevate nurse well-being and prioritize mental health in all of our programs, including Healthy Nurse, Healthy Nation, which continues to have increased engagement. The second area was improving care for our veterans. It's important to recognize that only about half of the nation's veterans are enrolled in VA benefits. And for those who are enrolled, the Mission Act and the Veterans Community Care Program have played a vital role in expanding access. But this means millions of veterans are receiving care outside of the Veterans Health Administration. And it's essential that community-based nurses have the knowledge, training, and resources to deliver high-quality, veteran-centered care. To support community-based veterans, ANA has joined ECRI's Salute program, which provides resources for veterans care. We've hosted national webinars on evidence-based screening and assessment for veteran patients, and there are more planned for this year. We published guidance in the American Nurse Journal on best practices, and we held quarterly meetings with VA leadership. And we've also advocated for top-of-license practice, especially for APRNs. As the proud husband of a veteran, I am personally grateful to this body for prioritizing the health and well-being of those who served our country. And to the veterans in this room, thank you for your service. Can we please give them a round of applause? Thank you. The third area of focus is based on the Code of Ethics for Nursing. The code is an essential resource that guides and supports nurses in maintaining professional integrity, especially as they make patient care and practice decisions. The code is revised every 10 years, and after an extensive review process involving a diverse panel of 49 experts and more than 6,000 public comments, the 2025 revision was published in January. Since its publication, the ANA team has been hard at work bringing the code to life, publishing articles, developing courses, and creating practical tools that translates its provisions into everyday practice. As we navigate uncertainty and respond to the rapid changes in the healthcare landscape, we will remain agile and ready to advocate for nurses in the profession. The code will guide us as we actively revise and update position statements and principles around critical topics that impact nursing today. And soon to come, updated position statements related to the care of the LGBTQ+ patients, health equity, nurse fatigue, and workplace violence. Beyond dialogue forums, ANA remains committed to supporting a multi-generational workforce by investing in professional development, strengthening the pipeline for future nurses, and advancing innovative care models such as virtual nursing. At the same time, we are laser-focused on nurse well-being and will continue to push for environments where nurses are empowered, respected, and protected. That said, workplace violence remains a reality in far too many healthcare settings. And workplace violence is not just limited to external threats. We continue to see incivility, bullying, and lateral violence within our own profession, and it's unacceptable. Earlier this year, ANA released an updated position statement addressing workplace violence, and right now we are working on a position statement written specifically to address incivility and bullying as well. Many of you are on Capitol Hill this week advocating for this very issue, and just so you know, your voices matter, and I believe that we have the power to make an impact. But let me be clear, our work does not stop here. While federal funding is at risk for grants and programs everywhere, we remain steadfast in our commitment to the Minority Fellowship Program, which ANA has been stewarding for more than 50 years. To date, the program has empowered more than 1,000 nurse leaders from diverse backgrounds to provide culturally competent care, especially in underrepresented communities, advancing health equity, increasing access to behavioral health services, and treatment to substance use disorders. Our team is actively working on scenarios and strategies to secure the future of this program, even if federal funding is zeroed out. Yesterday, CEO Goettl stated in her remarks, technology is ever evolving. And yes, I think we can all agree AI is here to stay. ANA can't afford to sit on the sidelines. We have both an opportunity and a responsibility to help lead the way. Nurses are natural innovators, and we must have a voice in shaping how these tools are developed and used, and focus on protecting patients, safeguarding our profession, and ensuring that ethics remain front and center. AI will never replace the human touch of a nurse, but when used thoughtfully, it can reduce cognitive burden, enhance safety, and improve outcomes across the healthcare system. Clearly, we have a lot to do, and while I'm just getting started, the first few months have been nothing short of incredible. I arrived at the association just in time for National Nurses Week, and it was amazing. This year, we put a spotlight on the power of nurses. We lit up 206 landmarks, businesses, and healthcare hubs. We even lit up Niagara Falls, which you can see in this picture, and if you've seen the video on social media, it was so impressive. We launched the first of its kind collaboration with our CSNAs to add value to their local events, from Massachusetts to California, from Hawaii to Guam, and many places in between. And I hope you saw that on social media as well. Perhaps the most exciting for me was the opportunity for ANA to show up and glow up Nurses Week at several health systems, including Baycare in Tampa, where I had the opportunity to tour several hospitals and engage with nursing staff and participate in a fireside chat with fellow nurse leaders. I look forward to going even bigger as ANA celebrates its 130th anniversary in 2026. As I said earlier, yes, absolutely, we're going to celebrate. As I said earlier, I'm honored to serve as your Chief Nursing Officer. I'm a proud nurse, grounded in humble beginnings that have shaped the person I am today. Every step of my career has been guided by a commitment to continuous learning, a passion for patient care, and a dedication to our profession. I was a flight nurse in the back of a helicopter once when my mentor said to me, "In this profession, the sky's the limit." We were at 8,000 feet, and I thought she was just joking, but she was right. My journey took me from that rural community hospital to this podium, serving as your CNO, and has included 2 decades of bedside care, serving as an EMT, a nurse practitioner, chief clinical officer, professor, and advocate. And now I'm excited to partner with you to imagine what we can accomplish together, harnessing our collective power to advance health, strengthen our profession, and ensure that nurses remain not only the most trusted, but also the most respected voice in healthcare. Thank you.